thought of.
All right. Dr. Chandra, what's your viewpoint? Urban lifestyles, sunscreen use, pollution, as cited earlier, these are modern habits that are silently worsening vitamin D deficiency or its uptake in the body despite abundant sunshine that's at our disposal. When we talk about some clinical problems, what are some of the red flags, some early signs and symptoms that people should worry about? There are cases of 30-year-old men and women that are doing just fine, they're sleeping well, but they still feel tired, and then they're diagnosed with deficiencies.
I want to give you a little context before I answer your question. So, in my
Yep.
clinical practice, both in US and India, I have seen in all my Indian patients, they're all vitamin D deficient or at least insufficient. Now, the reason being are many because, you said the bioavailability of the sun is there and the exposure is there, but that's not it. For vitamin D to be converted into an active agent, it has to go through your gut first. It has to be absorbed. So Indians have a lot of gut issue, which is like leading to malabsorption. So even if I give you the right amount of vitamin D, you may not be able to absorb it, and hence your body may not be able to utilize it. Also, it goes through the cycle or through the liver, and all of us, most of us, are at least, like NAFLD, which is fatty liver disease now.
Yeah.
But more than that, what I want to say is India is a very young, obese country. So my specialty is obesity medicine, and I see this in all my patients. So
Wow.
obesity indirectly affects your metabolic health of especially vitamin D cycle. So it's very common in obese patients or overweight patients. And why is that? Because the vitamin D is a fat soluble vitamin. So it gets trapped in your fat cells, which are already inflamed. They are enlarged adipocytes, and so the bioavailability of the active ingredient of vitamin D is absolutely almost 3 times lower than what you would see in a normal population. So it takes me almost like 2 to 3 times of the vitamin D dose to replace it and bring it to a normal serum level, quote unquote.
Okay.
But inside, the pathogenesis is deeper than this.
All right, but Dr. Chandra, it's called the bone vitamin. We've established that earlier as well. It's also established that there's clear-cut deficiency. If there is not deficiency, the levels are insufficient. But how often do you see children with rickets? How often do you see unexplained bone pain, stress fractures, osteoporosis that we've been talking about? I mean, these seem to sound like real dangerous and heavy medical terms.
Absolutely. It's becoming a silent pandemic in its own state, like with kids, as you mentioned, the severe form is rickets. But what they usually present with is, just weak bones. They will feel fatigue. Fatigue is often overlooked by mothers, often overlooked by, grown-ups. But that's how it also presents in adults. Like first symptom is a fatigue. Then, like especially in the elderly and the young population, they may have these silent fractures, which we call as compression fractures. Even without a strong impact, they will end up having, like bone fractures, especially
Yep.
the spine, or the heavy bones of femur, and, like especially in kids, like the tibia, like the leg bones. So it is pretty common. Fortunately, the replacement, with the right supplementation can be easy, but
Okay.
also just not the replacement, but the maintenance dose has to be done.
Long term.
All right. Dr. Chandra, let's give you the final word. Practically speaking, what's the right formula when it comes to balancing, for Indians? Is it safe sun exposure is something that we've spoken about. We've spoken about fortified foods. We've spoken about Surya Namaskar, preferably in the early hours of the day. And of course, supplementation. How personalized should it be, and what's the right balance for the average Indian out there?
I believe that's the golden question. And, as rightly pointed, you have to know what your baseline level of vitamin D is. Do not start self supplementing because over supplementation is pretty common. I do see hypervitaminosis D in my practice also, just because people forgot to stop taking it once a week, the pills and the capsules, or the little shots that people are taking. So you do need a baseline. We recommend to check again after 3 months or 8 to 12 weeks. And then we decide whether to continue a maintenance dose, which is 1,000 to 2,000 IU per day, or we give you a replacement dose, which is 60,000 K for like every once a week. The ideal supplementation is about 2 months. Now, having said that, we do try to supplement it with diet, but with Indian gut, At least in my practice, I have seen that diet sometimes is not often enough, not enough, and more importantly, one thing I want to tell through you to the viewers, another special kind of element you want to take with vitamin D is magnesium. We are absolutely deficient as a population in that, and magnesium indirectly helps you with the absorption of vitamin D. So before checking any kind of these supplementations, I do check what the magnesium level is, and also you want to make sure the calcium level is okay, because there's multiple endocrine orders that can also play a role in it. So
And this
magnesium
is all
supplement,
easily, detectable with the blood serum, with the blood test, right?
these are, yeah, you can totally get a serum magnesium level, but just adding magnesium in your diet through like dietary supplements or certain diet rich foods can be helpful too. So do not think it's just vitamin D supplementation that you're doing. It is the other elements that helps in its absorption and metabolism.
Doctors, before I let you go, and my question first to Dr. Shikha Sharma. Dr. Sharma, if we sit indoors from 9 to 6, the average Indian out there working the average 9 to 5, 9 to 6 these days, if not more, is 10 minutes of casual time in the sun. I'll take a stroll outside, expose myself to the sun. Is that really enough, Chandra?
I think, fun fact that people don't know, vitamin D is the only most studied kind of vitamin for longevity also, which has enough evidence behind it. So I think vitamin D supplementation for me is one of the most priority in any of my patients. And you will see that
Okay.
it indirectly helps in weight loss too. So that kind of supplementation in appropriate amounts for your body has to go through a doctor. Do not self-administer, and take this seriously. It is not just a vitamin deficiency, because it affects overall
Yeah.
body.
And self-supplementation can be dangerous, and magnesium is another thing that people need to be on the lookout for. Dr. Sharma, Dr. Chandra, many thanks for taking on the time and speaking to us here on News 9.